My name is Pat Warlock and I am one of two advanced care planning facilitators working within Aneurin Bevan University Health Board, and this is my colleague
Christine Fatwell. Hi. Macmillan have sponsored us for a 3-year project to implement advanced care planning throughout Gwent.
When we talk about advanced care planning, it can cover off many things, such as your wishes and preferences, just a statement of the care that you would want or not want. And what we are trying to encourage is that people think about their advanced care wishes, talk about them, share them, and in some cases write them down.
When we ask people, there's a definite lack of confidence. They lack the confidence to have that conversation. That's what people tell us. And a lot of that is about when. When is the right time to have the conversation with the individual I'm caring for? Some people see advanced care planning in a very negative terminology. They think, they think we're telling them they're dying. They think we're talking gloom and doom. They think we're taking away their hope. Our education programme is trying to focus on increasing confidence, giving them some more knowledge and understanding, helping them to identify when it is appropriate to speak to a person about advanced care planning. What our focus is to give every individual at least the opportunity to discuss advanced care planning if they want to, because it's completely voluntary.
One of our main roles is to engage with the public, to actively try and break down some of these barriers. We're aware that advanced care planning, talking about a possible future without a voice, is actually quite emotive and quite distressing. And we also understand that from a societal point of view, talking about death and dying has actually become a little bit no-go area. So when we engage with the public, we literally are talking to anybody who will listen to us. So we'll attend supermarkets, leisure centres, any venue where we can pop up this tabletop stand. We really want to spread the word to try and break down some of the societal barriers around advanced care planning, trying to explain to them the benefits. Advanced care planning discussions may not be for everybody, but unless we have that conversation, we're not going to know. And we're trying to encourage the members of the public to think about what's important. The benefits of advanced care planning clearly puts that patient in the centre of their care. It can reduce hospital admissions. It's also suggested that it can reduce conflict between family members and healthcare professionals. When patients are able to be nursed and cared for in their preferred place of care and actually die and end their life in their preferred place of death, what could be a greater benefit than that?
When patients suddenly realise they have got a choice, because they don't realise they've got a choice, and I can remember, so many, but particularly one in my head now is a lady who, she said to me, she'd been in and out of hospital so many times, she was getting more and more frail, and each episode where she became acutely unwell got closer together, and her quality of life, she said to me, was becoming unbearable. And when we sat and had that conversation about, you have a choice, you can make some plans, you can now tell us what your wishes are, what you want, what type of care you want, and even more importantly, what type of care you don't want. She was just absolutely sort of motivated into what I have a choice. She said, I feel I can now take control again.